Today we will talk about disaster management plan for infection control during hurricane. I'd like to welcome everyone to my presentation to the infection control plan for disaster management during hurricane. We'll talk about the main hurricane hazard today and look at practical ways to reduce those risks. Flooding, overcrowding in shelter, interruption to healthcare, stressors, or mental health and disease carried by vectors. Describe a thought disaster management strategy to reduce these hazards. There are many health concerns associated with national disaster, particularly hurricane. These include vector-borne infections, mental health stressors, flooding, overcrowding in shelters, and disputes in healthcare. Today, we want to provide an overview of all inclusive disaster management strategies that can lower these chances of infection. Understanding the risk. Disaster transmitted by water from tainted sources, transmission of contagious illness in small areas, increased infection risk for a result of treatment interruption, disregard for health and cleanliness, disease spread by mosquitoes from standing water. We'll look at the health dangers associated with hurricanes in this section. Flooding, particularly when combined with sewage, can result in waterborne disease from contaminated sources. Infection are more likely to spread in overcrowded shelters, and disadvantaged populations are more at risk for disparate healthcare services. Stresses related to mental health may cause people to neglect their cleanliness, and standing waters attract mosquitoes, which increases the risk for infection like West Nile virus and Zika. Evidence-based intervention. Frequent evaluations and upkeep of drainage infractions. Set apart particular location for populations that are at risk. Motor clinics for constant medical attention and immunization, counselors and wellness initiatives on site, localized indoors aimed at managing mosquito population. We'll talk about the important shelter to reduce the health risks during hurricanes in this section. Upkeep of drainage system is a necessary part of effective flood control, and shelter protocol should identify regions for valuable people. Contagious access to health care will be made possible via mobile clinics and on-site counseling for mental health and cruelty. Community-based program will lessen the likelihood of sickness and assist control mosquito reproduction. Ethical decision-making and DEI. Adapt interventions to different populations' needs, involve leaders in the community from a range of backgrounds to promote compliance and trust. It is essential that our plan take diversity, equity, and inclusion into account. The various requirements of this impact people must be taken into account while designing intervention. Involving community leaders in diverse backgrounds, culture trust improves a chance to help communication. Population needs assessment. Older people, families with modest income, people suffering from chronic illness. Make sure these populations have access for information and medical resources. To respond effectively, it is competitive to identify populations that are susceptible. The elderly, low-income family, and those suffering from chronic alignment should be our main priorities. Strategies that are specified designed to guarantee that these populations have access to vital data and medical resources. Interprofessional collaborations, local government, community organization, emergency management, and healthcare providers. Roles and responsibility. Give each team a defined role to play in carrying out the disaster management plan. It is essential that important stakeholders work together. These comprise local government, community organization, emergency management staff, and healthcare professionals. For this disaster management plan to be successfully implemented, each team member function needs to be clearly defined. Coordinated infection control measure, guidelines for distribution and use in the shelter, frequent reporting protocols, and infection rate monitoring. We'll set rules for appropriate use and distribution of personal protective equipment at shelters in order to control infection. Timely response and reporting will also depend on regular monitoring of infection rates. Evaluating emergency preparedness. Examine the advantages and disadvantages of the concurrent disaster response plan. Analyze the degree of community involvement, training, and resources. To determine the advantages and disadvantages of the concurrent disaster response strategy, we must evaluate our concurrent system matrix of pre-preparedness. Such community involvement and training levels will be useful in determining how well equipped we are to react. Communication plan. Make use of many platforms such as social media, neighborhood gatherings, and local radios. Adapt your messaging to appeal to various democratic groups. Involve your local authorities in order to properly communicate messages. Good communication is essential. We should distribute information through a variety of platforms such as social media, communication meetings, and local radio. Messages should be customized for a variety of demographic groups and increase comprehensive and interaction. Prioritize communication steps. Provide the community a set of precise, doable action. Regular communication during emergencies to alert the community. It is imperative that the population be educated about infection management. We must lay out specific, doable action that people can take. The community will also be informed throughout the tragedy by regular updates. Evacuation and recommendation. Community involvement, established protocol, community gaps and resources constraints. Boost self and volunteer training and better distribute resources. A thought evaluation of our plan will expose both our advantages, such as our establishment procedure and community involvement, and disadvantages, such as our lack of resources. These communication will center on improving resources and providing volunteers with more training. Continuous improvement. After a disaster, get input from stakeholders and community. Regular training, ongoing instruction to increase preparedness for all parties concerned. Creating a feedback system will enable us to gather opinions from community members following catastrophic incidents. We will be ready for emergencies in the future if all parties concerned receive regular training and communication education. Conclusion. The value of having a thought plan, cooperation, taking DEI into account, clear communication, and ongoing assessment. Call to action, urging interested parties to support the suggested course of action. In conclusion, in order to mitigate the risk of infection during hurricane, a thought disaster management plan is needed. Our reaction effects will be strengthened by cooperation, taking DEI into account, efficient communication, ongoing assessment. I urge all parties involved to make a comment to the suggested plan in order to improve community health outcome. Thank you.